Are you in dilemma for getting empaneled with Ayushman Bharat or not for your hospital? Then this video is only for you. Today I am going to talk about should you go for empanelment with Ayushman Bharat or not by critical analysis of all the aspects. It covers approximately 500 million people to the amount of rupees 5 lakhs per household. This amount is so big a number for any hospital that they can't ignore the huge potential of revenue source. But there are doubts, as there has been bad experience of private hospitals in various public health financing schemes like RSBY, the predecessor scheme. It is filled with numerous cases where hospitals have not received their payments for a long time, even up to years. Although many hospitals get empaneled with the PMJY, many more are adopting an approach of wait and watch. Based on critical evaluation of the scheme and the experience, here are the answers to some of the questions that matters for any private hospital to evaluate whether or not to participate in this scheme. Number 1, rates of PMJY are adequate or not. There are fixed tariffs for each of the 1350 treatments packages defined under the scheme. Rates of the scheme are usually similar to CGHS rates. Whether the rates are adequate or not depends upon the category of hospital and their operating cost. While maximum low operational cost hospitals are satisfied with the rates, the high operational cost hospitals finds it very low to recover the cost. However, for many hospitals, high volume of patients that the PMJY brings compensate the lower rates to some extent through the price volume effect on revenue. Second is, how much patients can the hospital expect through the scheme? PMJY will cover almost 50% of population of the India. The scheme has potential to give more patients than all private hospitals combined can serve. Smaller hospitals in Tier 3 and Tier 4 cities are in fact already generating up to 70% of their revenue from PMJY patients. The awareness campaign has been organized very well in many states. Number 3. What is incentive for NABH Accreditation certification or for good quality hospitals? The PMJY is promoting good quality hospitals by paying a percentage increase to the rate. As of now, NABH Accreditation certification is the only criteria that the scheme uses for recognizing a good quality hospital. A hospital with full NABH accreditation is paid 15% more, while those with only pre-accreditation status is paid 10% higher than the base package rate. The hospital with bronze level certification will get 5% more in comparison to base package rate. Fourth is, in how much time hospital will get the payment of the claim amount. There is fixed turnaround time of 15 days, 30 days in some states for payment of claims submitted by the hospital. If the payment is not done on time, a penalty of 1% of the claim amount per week of delay is to be paid to the hospital. Number 5 is, will they reject claim for non-serious reasons? There are checks and balances in the scheme to ensure that legitimate claims are not rejected. The claims usually go to TPA for verification. The process of verification and evidences to be checked is available in public domain. Number 6 is, how smooth is the entire process of empanelment and claim management? The scheme is executed through an online IT-based system which has made it efficient. Everything right from applying for empanelment to submission of claim, replying queries from TPA, extra or online. This has made the process faster, transparent and easier for all the involved stakeholders. Number 7 is, are other hospitals getting empanelment? Under the scheme, private hospital empanelment done by a process taking maximum 1 month time. The number of private hospitals getting empaneled with the PMJY is continuously increasing. More than 14,000 private hospitals have empaneled so far and many more are in the process of empanelment. The number of patients taking treatment in these hospitals and the total amount being claimed is continuously increasing. In many cities and towns, there are adequate hospitals empaneled, so that a hospital which is not empaneled are losing patients and revenue. Then number 8 is, what are the precautions that a hospital should take? Number 1, the hospital applying for empanelment should apply for all the specialties that they provide and cannot choose certain specialties for empanelment. However, the state has the right to reject some or all of its specialties for empanelment if the required criteria are not fulfilled. Once empaneled, hospital cannot refuse treatment to any PMJY beneficiary patient who reaches the hospital for services, except in certain conditions such as no beds available. Number 3, there are certain rules that the empaneled hospitals must follow. For example, no cash should be taken from PMJY patient, hiring and maintaining a dedicated staff called as Ayushman Mitra, refunding the OPD payment taken from patient, and in case if the beneficiary was admitted and treated, these two rules can lead to various grades of penalty. Overall, the scheme is good for those hospitals that operates in low to moderate operational cost. The challenge of non-payment, delayed payment, complex processes, etc. has been well addressed. High-class hospitals with higher operational cost, however, should examine the rates carefully before considering empanelment. They can plan to reduce their operational cost for bulk patients. If you want to know how to develop hospital business promotion strategy and hospital challenges in detail, then you can read our blogs on hospitaltraders.com and join our Facebook group or Hospital Well-Wishers. Link will be in description. If this video is helpful for you, like it, share with your friends and subscribe our channel. Thank you for watching the video.